It's not actually like a hospital. It is a hospital which is homely. The word is homely. Yes.
Even the name itself.
Yes. And he shared to us a feeling that he has lost so many friends due to alcohol and also due to mental illness, because he discovered that most of the people with mental illness don't understand themselves. And mental illness builds up slowly until somebody dies. And most of the times, they don't understand what is happening. They have a feeling that they cannot be able to explain to anybody how they are feeling. But it is very uncomfortable. It is something that is very uncomfortable that will either force you to go to substance or force you to kill yourself. Or you remain isolated. You isolate yourself.
Nidoka goko kwa Mr. Waiganjo huko wetagwo Snap Back Recovery Clinic. Kundu guku ni kundu kwa bata muno mwiroreri wakwa ndi mwiraga ndikamuhitha maundu mega aiko wina mundu mwaru hau utaraigua wega meciria na ni arenda ku recover ino ni rehab na reke tuingire tuone wega kuhana. Hode. Hey, Mr. Habari. Niwe tunaita nani? Samson. Samson Waweru, habari. Tumekuja huku, mbona nikupatie haka ili uongee tukusikie. Yes. Kwa hata mudhuri. How is this place?
The place is great, as you
can see. Wow, I can see.
Yeah.
Sasa huku ni wagonjwa wanaletangwa wagonjwa.
Hapa we deal with substance use disorders. That is alcohol, bangi, that is cannabis. Tunachukua hard drugs, heroin, cocaine, just anything.
Let's get in and see.
Substance.
Tuongee, I would like to talk to Madam Rose.
Yeah.
Ako?
She's in.
Okay.
Yeah.
Oh, this is the reception.
This is our reception.
Wow.
Yeah.
This is nice.
Yes. Karibuni sana.
Asante sana.
Yeah, Madam Rose is around.
Madam Rose ako?
Yes.
Ndiye tungetaka kumuona. I'm here. How are you?
I'm good.
Good. Hebu nikuweke hii kitu.
Yeah.
So that we can hear you very well.
Yes.
This place is good. My God.
Yeah.
I love it. Mimi nilikuwa nafikiria it's like a nyumba ya mtu ya kukaa.
It's a magnificent place. Whoever comes here loves it.
You can't say even it's a hospital.
It's not actually like a hospital. It is a hospital which is homely. The word is homely. Yes.
Even the name itself.
Yes. Have a seat.
Thank you.
Are welcome.
Thank you so much.
We love you.
Thank you. I love you too. You know, Paul is my friend.
Yes.
For quite a long time.
Paul Waiganjo is our director, and we love him.
That's so nice.
Yes. Equally, let me also comment about Madam Director. That is Mrs. Waiganjo.
Okay.
We work in partnership in Mr. and Mrs. Waiganjo. They are both our directors.
Okay.
And we humbly respect them. We respect them.
Now,
yes.
What kind of people do you deal with here?
Thank you for your good question. Thank you so much. And I will start by telling you that Director Waiganjo is the vision bearer. He's the one bearing the vision of this place. And what came into his mind as he shares to us, as we are employees, and he shared to us a feeling that he has lost so many friends due to alcohol and also due to mental illness. Because he discovered that most of the people with mental illness don't understand themselves. And mental illness builds up slowly until somebody dies. And most of the times, they don't understand what is happening. They have a feeling that they cannot be able to explain to anybody how they are feeling. But it is very uncomfortable. It is something that is very uncomfortable, that will either force you to go to substance or force you to kill yourself, or you remain isolated. You isolate yourself. So he discovered there is a problem with the community, and he came up with this program. Yes.
And how do you know when somebody is ill? Mental, maybe they have mental illness.
A good question. And I will first answer that one by saying I'm passionate about mental health. I simply cannot live without mental health because I embrace it with both hands. I love it. By the time I see somebody on the street, maybe at my home area, Nairobi or any other town, I'm able to identify and tell you this person is suffering from mental illness. And the first thing that comes into my mind when I see that, I keep questioning, why can't I be given this person to go and bring him back to normal within 2-3 days? But anyway, I'm not able to, nobody is able to answer that one. It's me who keep questioning myself. So we diagnose somebody to have mental illness through signs and symptoms. Signs and symptoms, they are called symptomatology. Signs and symptoms are the ones that guide us to know that this is a person suffering from mental illness, because this person with the mental illness behaves in an abnormal way. We have the normal ways of behavior, but the minute you divert from the normal ways, you go to the abnormal side. As somebody who has trained in mental health can tell this person is not following the right track. That's how we come up with, that's how we diagnose our clients. All the same, we use the DSM-5, whereby DSM-5 help us to classify a condition where it belongs. We have various types of mental illness. We have bipolar mood disorder. We have schizophrenia. We have major depression. They are different. We have kina dementias. You'd classify them using DSM-5. Yes.
Okay. Now, let's assume I have somebody who is sick.
Yes.
And I don't know exactly what happened.
Yes.
To him, but I can tell this person is not good here.
Yes.
How do you recognize what happened to them?
Very nice question, and thank you so much for that question. And I can assure you this, when somebody is mentally unstable, it is either the other person who realizes that person is not okay, but for them, they are not able to tell that they are not okay. And that's why when you take them to a mental hospital, they keep arguing, you are the one who is sick. You tell the doctor he's sick. He repeats, he's the one who is sick.
Do they know when they are sick, like when they have mental illness?
Most of the times they don't know. And most of the times they know. Because like when you are living a normal, there's the normal lifestyle that we keep. So the minute I realize I'm diverting from my normal lifestyle, most of the times I might question myself. Why is it happening like this? At times you are able to question yourself, but you have no answer until somebody realizes for sure this person is diverting from the normal to the abnormal. That is the best word to use. So what happens, for them, they don't realize unless somebody tell them what you are doing is not normal. But even if you tell them what you are doing is not normal, it takes time for them to understand what you are telling them. So at times you either engage yourself to pick that person, take them to the hospital, use another person, use the police. Actually, I can give you some modes of admissions. We have voluntary admission, whereby a client walks in by themselves seeking for mental health treatment. We can have this involuntary. Martin realizes Rose is not well. You go get hold of Rose, push her to the hospital. We can use the police. We call it emergency.
Emergency are those people who are violent.
Yes, emergency admission is that the police, the community realize somebody is behaving, somebody is a problem to the community. Like now you are stoning cars on the highway, you want to kill somebody, the police have to come in, get hold of you, put you in a cell, then present you to a psychiatrist where you are seen as an emergency patient. We have the armed forces admission. Those are some of the admissions I can comment about. So when you arrive in the hospital, we do something we call mental status assessment. Mental status assessment carries everything, whereby we check your outlook, your physical outlook, we assess your speech, we assess your mood, we assess your orientation, concentration, we check your memory, abstract reasoning, judgment. Then we are able to come up with something we assess whether you have insight. At the end of our assessment, we shall tell whether this person has insight or you don't have insight.
Okay.
When you don't have insight, it means you are not aware. Self-awareness is you don't have it.
Yeah.
Lakini when you have insight, uko na self-awareness. You understand everything. You know what is happening. The assessment will be good at the end of it. But if you realize somebody has no insight, you admit that person, put them on treatment so that they can regain back their insight. And before we do all those, we also do something we call investigations. Because mental illness can be as a result of the physical illness. So we have to do the investigations to assess whether you have any other physical illness before we conclude this person is having mental illness.
Okay.
We also do radiology tests, like now CT scan if it's necessary. Yes.
You do blood work?
Those are the blood works also, to assess whether you have those other conditions that can lead to mental illness. We also assess, because we've also come up with this, we've realized that when somebody is suffering from a chronic illness, like now cancer, hypertension, you are prone to mental illness. We do all those assessments.
Okay, now there's some other diseases which can trigger mental illness.
Yes.
STD or STI, which one is it?
Thank you so much, Martin. A good question. There's something we call, there's a difference between urinary tract infection and sexually transmitted diseases. Urinary tract infection simply means you have a urinary tract infection that does not necessarily is associated with sexually transmitted. But sexually transmitted, it is as simple as it is called the STI.
STI.
And this STI can expose somebody to mental illness simply because the minute you get this infection due to that sexual contact, in the community, people find it to be a bit funny because it's a shameful. They view it like something like it is so shameful.
Yeah.
So for one, they don't want to seek for treatment. They sort of go into depression because they have signs and symptoms, but they fear the outcome.
Yeah.
Because we have these conditions which are like now chronic ones like HIV.
Yeah.
Somebody is in sort of, they don't understand how to go about it. So at times they don't seek for treatment early and the disease advance. We have what we call, like now, HIV. You need to know where your status early so that you can be put on treatment.
Treatment, yes.
We have venereal diseases. We call them, there's a test we do to detect venereal disease, that is syphilis. We do a VDRL to test whether you have syphilis. In case you have syphilis, we treat that syphilis. In case it is not treated, it goes up to the last stage, that is mental illness. It causes mental illness. So when you realize this person has got mental illness, secondary, we call it secondary. Secondary simply means this is not the real cause. Like now, you have mental illness secondary to syphilis. Syphilis is the one that has caused the mental illness. That is the meaning. So what we do, we treat both. If it is HIV, we manage it. If it is syphilis, we manage the syphilis, we manage the mental illness. And I can assure you, mental illness is manageable. Don't stick at home thinking that mental illness is the last stage of your life. It's very much manageable, and you can get you can get treatment, follow up, and you go back to your normal job or occupation. Very much possible. So it happens the way you say it. There are some physical illness like the syphilis, HIV. Those are the conditions that bring about a lot of stress until we go into mental illness.
Wow.
Yes.
Now, I know you have nurses here.
Yes.
Are nurses, doctors, or how do you work here? How do you work here?
When you are dealing with mental illness, you have to employ a multidisciplinary team. Multidisciplinary team means you have psychiatrists, you have nurses. A psychiatrist is a medical doctor who specializes in psychiatry. We have mental health nurses. Rose here is a mental health nurse. We have another nurse by name Samson. Samson is a mental health nurse. We have counselors. Counselors are very vital in such an institution because some of these clients need a lot of counseling because we need to stabilize them back to their normal life. Okay, they diverted at a certain level, developed mental illness, so you have to get hold of this person, walk them through the journey until they are back to normal. And that's the work of counseling that will take them back to where they came from. You do one-on-one, that is individual therapy. We engage them in group therapy. We engage them in family therapy. Simply because when one person in a family is unwell, the whole family is sick. So you have to bring the whole family on board, do proper counseling so that this person can go back home and fit there. And the family is going also to understand this person back at home, why they behave the way they behave.
Okay, by looking at me, yes. Am I normal?
You are very much normal.
I was like,
You are very much normal.
You guys, when it comes to mental doctors, they can look you like this and tell, they say that person is not 100%.
Yes,
normal.
Martin. Yeah, what happens really? Our assessment is, I talked about mental status assessment. Our mental status assessment starts from the outlook. By looking at you, are you able to keep eye contact? How is your speech? How is your mood? How are we able to establish a rapport? Are we able to maintain it? Those are some of the things that we assess. Like now when I give you a seat, are you comfortable? Are you able, how is your posture? How is your posture? How is your, there are so many, do you have mannerism? Do you have tics? Mannerism is like you keep doing some funny things during the conversation. Tics are things you cannot control. Like now the hand is shaking. Those are called the tics. You cannot control them. Those are things that we assess to know whether this person is normal. That is now the outlook.
Okay.
We also assess your dressing. You could be very smart, but your shirt is upside down.
Upside down.
It portrays a lot of this communication.
There is something which is not going well.
Yes.
Okay.
How is your Are you kempt? Did you take a shower? Those are some of the things that we engage, because a normal person starts their morning by taking a shower. They groom themselves well. But the minute you realize this person is unkempt, the grooming is questionable, you start wondering.
And if somebody is too clean,
Yes.
because there is a word
Yeah.
of those, like for somebody who is so clean, like they don't want to see their shoes dirty, they want everything is clean. What do we call those people?
Nice question. It's called OCD.
OCD. Is it a disease?
It is. Obsessive compulsive disorder. Obsessive compulsive disorder. It is in somebody's mind. Like now, you are too clean. Somebody touches you, you feel like you can beat up that person. It is called obsessive compulsive disorder, and it is manageable.
That is a disease?
It is.
Okay, I hope I don't have it. Now,
Yes.
okay.
Yeah.
You say you have doctor, you have nurse.
We have psychologists. We have the kitchen managers. Those are the ones who serve, who prepare food for our clients. We have the gate person, that is the security personnel. We have the social workers. A social worker is the person who goes outside there, identify the problems of this person in relation to the community, and at least we are able to associate, because you have to do thorough investigations in order that so that you can be able to know what is really disturbing this person. You have to go deeper, so you have to use different personnel. Yeah, so it is a multidisciplinary. We use a multidisciplinary approach.
What do I need? If I have a patient,
Yes.
what do I need to do to bring them here?
You simply need to walk in.
Just
the
to
gate
walk
is
in?
open. Yes, the gate is open. Get the client, bring the client to us. We shall receive the client. From there now we start our assessment.
And how? I don't know whether you're free to say that. How
Yes.
are the payments and all that, or it depends with the sickness of?
I can assure you without fear that our prices are affordable, affordable, very much affordable. We are charging at least 50,000 per month. I think that is affordable. I think that's a fair price. Yeah, that is per month.
And then, how many months does a patient supposed to be in the hospital?
Yeah, thank you for that good question. But the charges are individualized. That is, it depends on individual care, because maybe I'm using substance or somebody is using substance. We engage a process called rehabilitation process. Another person has pure mental illness, you manage that person as per their individual care. Yeah, we don't manage them the same. Yeah, so when I talk of at least 50, that is depending on the individual care.
Wow. Okay.
Yes, and the individual need.
Can you give them? Can you give these guys the phone number that they can call if they have any patient or something?
Yes.
They can call you
Yeah.
and inquire any information that we didn't mention here.
Yes, we have a telephone number. We have an email address that I can share, so that in case somebody is in need of our services, they can call this number. It is 0768 752 976.
Yeah, you can.
Can I repeat? Can I repeat it again, please? 0768 752 976. Yeah.
You guys, my friends, wherever you are, if you know any person or any patient who can be helped here, you are much welcome. come and talk to Madam Rose, and everything will be all right. So, Madam Rose,
Yes.
is it okay we can go upstairs and see kitchen and see everything?
We shall walk all over. We have a magnificent compound.
Yeah.
First floor, second floor. We are going up there so that you can view for yourself how the place is. Yes.
So, we can go?
We can go.
Yes.
Karibu.
Asante sana.
Welcome. This is our kitchen where we manage the meals for all our patients. And our kitchen manager is Mrs. Jane Mugwanja.
Jane Mugwanja.
Yes.
Okay. What are we eating today?
Leo tunakula hii inaitwa matoke.
Matoke,
Na spinach.
So they eat healthy.
They eat healthy.
That's so good.
Yes.
Maybe most of them they never eat like matoke imepikwa vizuri because maybe they don't have anyone to cook for them.
She's a
So when
good
they
cook.
come here,
Yeah.
they eat perfect.
Yeah.
Oh, that's so good.
Balanced diet.
They
Balanced
take
diet.
a balanced diet.
Okay.
Yeah, and it is prepared by a nutritionist.
Oh.
Yeah, the diet
So
plan
they
is-
have what do we call? We call it
Menu.
menu and all food.
Yeah.
Tulikuwa
All types of-
tunaziitaje?
we call them a menu. Like now, the menu for today is matoke, spinach, and some proteins, some meat.
That's good.
Yes,
Thank you so much.
yes.
Yeah.
And
so,
she's a good cook.
yeah.
Yeah,
Okay.
she's a good one.
Nitakula nisikie kidogo.
So welcome. Can we? This is our reception.
Okay.
Whoever comes here, we receive them at the reception area. They sign a visitor's book.
Okay.
Yes, yes. These are the meals rooms. This is room 1.
Okay.
Then here we have another room called Masai Mara. Masai Mara is a male unit.
Unit.
Yeah, this is where we admit male patients. And this other area.
Okay.
Maybe we can see this one. Come in, welcome.
Wow.
You are welcome, come in. This is our male unit. This is one of them.
It's good.
Yeah.
So here they can be 4.
Here we keep at least 4 patients because we ensure that there is good lighting,
Yes.
there is good ventilation, they are comfortable.
Yeah.
We ensure good comfort
Yeah.
and security. Yes.
That's good.
Yeah.
That's good. There's a bathroom right there.
There is a bathroom right here. It is
beautiful.
more a washroom. They do their bathing there, everything there.
Okay.
Yes.
That's so good.
Yeah.
So
Yeah. And our floor.
and the floor is so
I don't know
good.
how you like it.
Yeah, so good. I love
Yeah,
it.
we are able to maintain it because we need a floor that we can be able to clean. So, because in a hospital you need to maintain a lot of cleanliness.
Yeah.
Yes.
Okay. So
Yeah.
are we going to go upstairs?
We are
now?
going upstairs.
So first floor is for
Male patients.
male patient.
Male patients.
And what is this?
Yeah. Meet Kagema here.
Oh, Mr. Kagema.
Mr. Kagema maybe can explain to us what he does here. We can share with him. Yeah. So Mr. Kagema is here with us. Maybe he can tell us what he does here.
This is where we study, we psychoeducate our clients, and we take them through counseling steps of recovery. We talk about recovery, and we do our steps here. Yes, and our meetings with group therapy, all of them, they are done here.
Oh,
Yeah.
and that's awesome. That's so good.
So as you've heard from Kagema, this is like a classroom whereby they come sit, do what he has told us is done on daily basis. They start in the morning with prayers. We engage a biopsychosocial stroke spiritual model of managing these clients of ours. So spiritual care is very key, very key. So in the morning we start with prayers. We go to our morning meeting. They give their views because ours is to listen to these people. We need to know what they want. If they have any problem, they raise their problems.
Yeah.
So we do a meeting every morning.
Wow. Okay.
Yes.
That's so good.
Yes.
Yep.
Yeah. From here, maybe we can go now to the female side.
Okay.
The female floor.
From
That
female
is the second floor.
Okay.
Yes.
This is the other room.
This is
Okay,
another
I
room.
remember,
It's called Mount Kenya.
Kenya.
It's called, there's somebody inside, so we cannot go in. Mount Kenya male department.
Yes.
So you are welcome to the female side.
Thank you so much.
Yeah.
I like this program.
Female side, we admit patients, female, and we admit patients from age 18 and above.
18 and above.
Yeah.
Okay.
Above, there is no limit. Yes.
Now,
Yes.
this is the bathroom?
This is just a side room.
Oh.
Yeah, that's
okay.
just a side room.
Wow.
Yeah,
This place
just a
is
side
clean.
room. Yes. That's
So
just
nice.
a side room. This is one of the female room. The other one, there is somebody inside, so we cannot go
cannot
in
go
right
in there.
now. So we have a capacity of 50 patients at present. But very soon we are going to expand.
Yes, I believe that too.
Yes.
Wow, that's so
Yeah.
good.
Yes.
So we can go and see outside.
Yeah.
How outside look like?
We can go to the compound.
The compound. Yeah.
Yes.
This is very nice.
Yeah. But we don't allow the patients
To come
around
here.
this area on their own. Simply because mentally sick patients can be suicidal, they can be homicidal,
Yeah.
any of the two. So we keep monitoring them for 24 hours. The minute you open this door, let them out on their own, they can do anything.
Yeah, they can do it. They can jump.
They can jump.
Wow. Okay.
Yes.
Where?
We
This is
ensure
nice.
safety is the first thing that we check
And
on
where
daily
is,
basis.
where is this hospital located?
This hospital is located at Roiro, exit 13, that is at the Thika Superhighway, kwa Cairo.
Cairo.
You come past Mogodha, iko up opposite Mogodha Primary School. Opposite here we have Mogodha Primary School.
Okay.
Down there we have PCA, Mokoyoine. Then across here we have Evergreen Car Wash.
Okay.
Yes.
So if I go to Google,
Yeah.
what am I going to Google exactly?
Yeah. Snapback Recovery Clinic.
Because I used that one when I was coming here.
And we have a pin. We have okay. We can share our location.
Location.
That area is
that
somewhere
area.
there.
Oh, okay.
Yes, they love that.
They love that.
Yes.
Yeah.
Alafu they love football.
Football.
We have a
And I
ball
saw somebody
there.
doing basketball here.
Yes,
Okay.
we do it. Alafu the compound area. We clean our compound on daily basis to ensure good security and cleanliness. So this is simply our compound.
This is so nice.
Yes, and we have a ablution block there.
Okay.
Yes.
Oh.
Yeah.
Wow.
Yes.
You guys, if you have anyone who is not feeling well,
Yeah.
somebody who want to come here,
Yes.
please, this is the nice place. This is a place to be. Just call Madam Boss,
Yes.
Madam Rose,
Yeah.
with the number that is going down there. Mwambie whatever you want, or the problem you maybe a patient have, and they are going to help you. She is going to help you.
Yes.
So thank you so much, Madam.
Yeah.
Nimefurahi.
Please give us a call.
Yes. Thank you so much. Appreciate.
Thank you.
God bless you.
Yes.
Thank you. You go far.
Thank you so much.
Thank you.
Yes.